If you can understand and learn about this one single medical problem, you can significantly reduce the risk of developing obesity and also the risk of developing multiple diseases like diabetes, hypertension, heart disease, thyroid issues, and so on. Hi friends, my name is Dr. Ranganath and welcome to my YouTube channel. In the previous video, I had talked about a medical condition called metabolic syndrome, and we had also learned that the primary cause for development of metabolic syndrome is insulin resistance. So in this particular video, we will try and learn what is insulin, what are the functions of insulin, and what is insulin resistance, what are the reasons for development of insulin resistance, and if at all there is insulin resistance, what are the diseases that can come with insulin resistance. See, insulin is a hormone that is secreted by the pancreas. Pancreas is a gland that is present inside our abdomen, which is located just below the stomach. So the beta cells in the pancreatic gland secrete a hormone called insulin. The primary function of this insulin is to reduce the blood sugar level. So insulin along with other hormones help in maintain the blood sugar level within a narrow range. The maintenance of the blood sugar level within a narrow range is very critical for the health of a particular person. If the blood sugar level goes up, then that causes problem in the long run by causing diabetes and other diseases. If the blood sugar level goes down, that is a very emergency problem where the patient can actually die because of a low blood sugar level. So what we need to understand is hypoglycemia or a low blood sugar level is more dangerous than hyperglycemia or a high blood sugar level. So to maintain the blood sugar level within a narrow range inside the body, there are basically two groups of hormone. The first group is called the hypoglycemic hormones, where the function of these hormones is to reduce the blood sugar level. And the second group of hormones are called the hyperglycemic hormones, where the function of these hormones is to increase the blood sugar level. And we need to understand that there is only one hypoglycemic hormone, which is insulin, which mainly reduces the blood sugar level, especially after the blood sugar level goes up after a meal. Whereas for increasing the blood sugar level, there are about 7 hormones, the most important of which is called glucagon, which actually acts exactly opposite to that of insulin. So what we need to understand is, for reducing blood sugar level, there is only one hormone, but whereas for increasing the blood sugar level, there are about 7 hormones. So if one hormone is actually acting against 6 to 7 hormones, obviously that particular hormone has to be a very strong hormone. So insulin is a very strong hormone, and whenever there is dysfunction or abnormality in the function of the insulin in our body, this leads to various diseases and various medical conditions, which we will learn in the course of this video. To understand insulin and the glucose metabolism in the body, we need to understand some basic components about the food that we eat. Basically, there are 3 macronutrients in the food that we eat. They are carbohydrates, proteins, and fats. So most grains that we eat are predominantly made up of carbohydrates. So the concentration of protein varies based on each of these grains. For example, millets have higher concentration of proteins as compared to other grains. Carbohydrates are nothing but multiple units of simple sugars like glucose, which are attached to each other, and ultimately they form carbohydrates. So whenever we eat a meal which is predominantly carbohydrate based, this carbohydrates ultimately digested inside the body and converted into glucose, which is absorbed into the blood through our intestine. And the second thing that we have to understand is about the processing of these carbohydrates. The processing of the carbohydrates is nothing but where they remove the outer layer of the carbohydrates, which contains fiber and other essential vitamins. By removing this outer layer, the predominant macronutrient that is present inside this refined grains is carbohydrates, which gets easily digested in the body and gets converted into glucose. And the other thing that we have to understand is about the sugar or the sweet that we normally intake. Sugar chemically is called sucrose, which is made up of one molecule of glucose and one molecule of fructose. So, and sugar does not contain any other nutrient. So whenever we eat a lot of sugar, this gets easily digested in the body and ultimately gets converted into glucose and fructose, which is absorbed inside the body. So what happens is, when we eat a lot of refined carbohydrates, when we eat a lot of sugar in the diet, so it ultimately gets converted into glucose, and which is rapidly absorbed inside the body, and this causes a increase in blood sugar level. So any increase in blood sugar level, there is an increase in insulin level, which will try to bring this blood sugar level down. So what we have understood is, whenever we eat a meal which is predominantly made of carbohydrate, especially refined carbohydrates, and a meal which contains a lot of sugar, so this causes a rapid increase in the blood sugar level. So whenever there is a rapid increase in the blood sugar level, the pancreas secretes insulin, which helps in controlling the blood sugar level. What this insulin does is, it sends the glucose from the blood into all cells of the body, where it is utilized as energy. The insulin goes and gets attached to a receptor called the insulin receptor. This actually works like a lock and key mechanism, where the insulin goes and sits on the insulin receptors, and the door of the insulin receptor opens, and the glucose enters the cells of the body, thereby bringing down the glucose level inside the blood, and this helps in maintaining the blood glucose level in a narrow range without actually the blood glucose level going up or going down. So now let us see what is insulin resistance. Before actually going into insulin resistance, let us understand the meaning of the word resistance. So the meaning of the word resistance is when someone or something is stopping or preventing a particular action. So let us take a couple of examples to understand the meaning of the word resistance. So let's assume that we are trying to open a door of a room which has not been opened for many months. So whenever we try to open that particular door, there is very high chance that the door is actually jammed, and it is not easy to open the door. So that is what we call that there is resistance to opening of that particular door, and we require more force to open that particular door. The second example that I can give is, suppose we take an example of a factory where there are some workers who are actually not working because of any particular problem. So they have some resistance to work, and if we have to get the same amount of action or same amount of output from that particular factory, so what we need to do is we have to put in more people to actually get the same amount of output. So what we can get from these two particular examples is that whenever there is a resistance to any particular action, either we require more force or we require more people to actually overcome that particular resistance. So whenever there is insulin resistance in the body, the insulin that is present inside the body is actually not enough to perform the action that is required. So what the body does is, the body produces more and more insulin to overcome this resistance. So to perform the same level of function, that is same level of lowering of blood sugar level, the body requires more amount of insulin whenever there is insulin resistance, and the insulin levels in the blood actually go up. Now we have understood that whenever there is insulin resistance, the body compensates by producing more and more insulin, and the insulin levels in the blood actually go up. Now let us understand what causes insulin resistance. To understand what causes insulin resistance, I will give you three examples. So the first example is that of antibiotic or drug resistance. So we all know that there is something called a antibiotic resistance or drug resistance. So we use antibiotic whenever we have a bacterial infection. So what this antibiotic does is, this antibiotic kills the bacteria, and an infection is taken care of. Suppose that particular person starts taking antibiotics repeatedly, either because he has repeated infections, or he starts taking antibiotics on his own without consulting a doctor, or the doctor starts prescribing antibiotics even for minor infections. Then we come across a situation of antibiotic resistance. So what happens in antibiotic resistance is, the bacteria develops resistance to that particular antibiotic. So that same antibiotic will not work against that particular bacteria. So what we have to do is, either we have to change the antibiotic or increase the dose or put higher antibiotics in that particular situation. The second example is that of alcohol resistance. So let us assume that a few college students have gone for a party for the first time, and they decide to consume alcohol. So let us imagine that they take a pint of beer. So there is a very high chance that after just a cup, 1 or 2 pints of beer, that particular person gets high, and he will not be able to have any more alcohol, because he starts feeling dizzy and have symptoms of alcohol intoxication. Let's assume that the same students go to a party after 6 months or 1 year, and they again take that particular alcohol, that is a pint of beer, and since they are having this alcohol after a gap of 6 months, then they will have the same effect after taking that 1 or 2 pints of beer. So let's assume that instead of having parties occasionally, they start drinking every weekend, and what will happen is within a matter of 3 to 6 months, they start developing alcohol resistance. So for the same effect of alcohol, that particular student or person requires more amount of alcohol. So even a pint of beer will not be enough, and he will start requiring 2 pints, 3 pints or 4 pints of beer for that particular effect. So this is called as alcohol resistance, where the same person requires more amount of alcohol for the same desired effect. And the third example that I want to give is that of sound resistance. Let us assume a person has moved into a new house which is located just by the side of a railway track, and whenever they have gone fresh into that particular home, they always notice that notice the sound of the train that is going on. Even in the night when they are trying to sleep, if the train is moving, they get disturbed because of the sound of this train. If they stay in that particular home for about 6 months or 1 year, the same sound they will not be able to appreciate. That is, the sound will not disturb them. So that is what is called as sound resistance. Their ear has become resistant to that particular sound. So we have seen 3 examples. One is that of antibiotic resistance, which is caused by repeated use of antibiotics. The second is alcohol resistance, which is caused by repeated use of alcohol, and third is that of sound resistance, which is caused by repeated exposure to that particular sound. So what we have learned from these 3 examples is a resistance to a particular stimuli is developed by repeated exposure to that particular stimuli. So repeated exposure to sound causes sound resistance, repeated exposure to alcohol causes alcohol resistance, and repeated exposure to antibiotic causes antibiotic resistance. So if we apply the same principle to that of insulin, so we will come to know that the body develops resistance to insulin because of repeated exposure to insulin. So what I mean by repeated exposure to insulin is when the insulin level in the body stays higher for a longer period of time, that causes insulin resistance. So insulin causes insulin resistance. So persistently high insulin levels causes insulin resistance. Now we have come to know that a persistently higher level of insulin in the blood causes insulin resistance. So what causes higher insulin level is whenever we eat food that is predominantly high in refined carbohydrates, whenever we eat food that has high amount of sugars in it, that causes higher insulin levels in the blood. So if we eat this particular food occasionally, once in a while, say for example we go to a party, we go to a function, then we eat this kind of food, then the blood level sugar levels will increase, the insulin levels will also increase, and after some time the insulin levels will come back to normal. And if you come back to normal eating pattern, the normal insulin levels in the blood would be maintained. But instead of this, if we start eating this particular food very frequently, what will happen is the insulin level keeps on going up, and the other risk factor is frequent eating. So what will happen is whenever you have a meal, the insulin level will go up, and after 2-3 hours the insulin will come down. And if you do not eat for say for example 4 to 5 hours, the insulin level will stay at this bottom level, and it will again rise after you have a second meal. So what will happen that if you start eating frequently, if you start eating when you are not hungry, what will happen is the insulin level will go up. The insulin level, before actually coming down to the bottom, since you eat in that particular time, the insulin level again will go up, and since you eat a lot of refined carbohydrate and sugar, the insulin level goes higher than its normal peak, and before actually coming down, the insulin again starts rising because you start eating frequently even when you are not hungry. So what this does is the insulin levels rises frequently and does not come to its lowermost point, thus causing a higher persistent level of insulin level in the body. So another factor for developing of insulin resistance is late eating. See, this insulin hormone works very well during the daytime. After evening hours, say for example after 6 or 7 p.m. in the evening, the function of the insulin actually starts going down. So this is like our government employees who work within a specific time frame, say for example from 8 to 5 or 6 in the evening. So this insulin hormone will not work properly late in the evening and night, what that means is if you start eating very late in the night, say for example you have your dinner at 10 or 11 o'clock, or if you start eating early in the morning before sunrise, the insulin hormone does not work well. If the insulin hormone does not work well, what will happen is the blood sugar levels will go up. If the blood sugar levels go up, that contributes to development of insulin resistance, and if the insulin resistance develops, that leads to multiple diseases. Now we have understood three major reasons for development of insulin resistance. One is increased intake of refined carbohydrates and sugar in your diet. The second reason is eating frequently, eating when we are not hungry. And the third reason is eating late into the night. So these are the three reasons for development of insulin resistance when it comes to food. So what happens is whenever there is insulin resistance, body secretes more insulin, and whenever there is more insulin, that causes insulin resistance. So this vicious cycle of insulin resistance and increased insulin in the body continues, and as long as this vicious cycle continues, the insulin resistance cannot be controlled. The only way by which we can control this insulin resistance is actually by breaking this vicious cycle, by changing our food habits and other lifestyle habits. The other risk factor for development of insulin resistance related to food is eating too much of processed and packed food. So all this packed food contain a lot of preservatives, lot of food additives. So they also contribute to insulin resistance, and eating all these artificial sweeteners also contribute to the development of insulin resistance. Now we have understood the factors that are related to diet which will contribute to insulin resistance. Now we will try to understand the other factors which can also lead to insulin resistance. The other factor that can lead to insulin resistance is lack of exercise. So whenever somebody is very sedentary, they don't exercise, they also develop insulin resistance very fast, because what will happen is if you try and build your muscles, if your muscles are strong and if your lean body mass is more, so the muscles actually can store more amount of glucose within the muscles as glycogen. So roughly 2000 to 2500 calories of glucose, that is actually the calorie that is required for a single day, can be stored in the muscles as form of glycogen. So whenever somebody has a lot of muscles, so even if they eat extra calories, these can be stored in the muscles in the form of glycogen, and this does not contribute to increased blood sugar levels. And if the blood sugar levels do not go up, then that does not contribute to the development of insulin resistance. So any person who has a very good muscle mass, who exercises regularly, the insulin tends to be sensitive and the chance of development of insulin resistance are less. The other major risk factor for development of insulin resistance is lack of sleep. Lack of sleep contributes to insulin resistance in multiple ways. One is somebody is waking up late into the night, there is very high chance that he will be eating during that time, and there is also high chance that he will be eating more of energy dense and calorie rich food in that particular time. And as already mentioned, the insulin hormone also and various other hormones also do not function well in this particular time, and when the person develops insulin resistance, there are studies that have shown that if a particular person is sleep deprived for as less as even 7 days, the glucose metabolism is affected, and the glucose levels of that particular person goes to the level of somebody who has pre-diabetes. And one should also try to understand that apart from rest that is given to the body during sleep, the body goes into reparative mode during sleep. So whatever that is damaged is actually repaired during sleep. So it is very important to focus on sleep. One should sleep for at least 7 hours every day, and this also helps in bringing down the insulin resistance. So now we have identified the major reasons for development of insulin resistance. So we will try to find out what will happen if there is insulin resistance. As we already found out in the beginning of this video, that insulin is a very strong hormone. So whenever there is high level of insulin in the body, what this will do is insulin will try to hold up water inside the body, and insulin is a fat storage hormone. So whatever excess calorie that we consume is actually converted by insulin into fat, and this is stored inside the fat cells, and this is actually locked up inside the fat cells. And as long as the insulin level is high, the body will not be able to utilize this fat. So insulin promotes to the development of obesity, especially central obesity, that is accumulation of fat around the belly, which contributes to development of multiple diseases. Since insulin holds up water and salt the amount of water and the salt in the blood levels increase, which contributes to the development of hypertension. So insulin contributes to the development of obesity, diabetes, hypertension, heart disease, hypothyroidism, gout and various other diseases indirectly. If you found that video was helpful to you, you could learn something from this video. Please like and share this video and subscribe to my channel so that I can create more content. You can ask questions related to this particular topic or any topic by typing your comments in the comment section below. If you want to learn more, please connect with me. The details have been given in the description box, and don't forget to subscribe my channel. Thank you.